Dr. Sanchina, you talked a lot about diffuse large B-cell lymphoma, and just one question that, again, usually comes up in diffuse large B-cell lymphoma. There's been a lot of new data that's been coming, and you talked about the POLARIX trial, right? And there has also been new kids on the block, such as brentuximab and nivolumab, really being tested out in this setting as well. So how have you taken this data and really going ahead with treating patients at the frontline, newly diagnosed diffuse large B-cell lymphoma stage? Do you always now revert to polatuzumab as your option, or are there instances in which you would go for brentuximab, nivolumab, or just fall back to plain old R-CHOP, which has stood the test of time for 40 years?
Yeah, so I think a lot of things obviously are rapidly changing. I think in the frontline setting, for the most part, your options are still sort of chemotherapy based, to be honest. Um, there are good clinical trials as well for patients in the frontline setting. So recently there was a clinical trial that was open through Dana-Farber that was also open at our institution. It actually included Polar R chip in the first line setting for all patients, whether they were GCB or non-GCB, and it included a bispecific T cell engager in the front line. Again, this was only for patients who had very aggressive disease. But obviously that we finished enrolling here. All my patients have done really well. I don't know, I obviously don't have the data or the results of any of the full trial, but I think you're going to start to see more bispecific engagers, to be honest, being used earlier on. Just because, like I said, it is much easier to use a bispecific than do CAR T cell. I think the order of things is very complicated, and it likely will not have studies, that they're going to confirm exactly what the correct order of treatment is. But for the most part, if a patient is not on a clinical trial, standard chemotherapy is basically still your frontline option.